River State, Dr. Adeze Ore. She's been taking us through a wide range of health issues in River State as provided by the River State government. But on this segment, that was a recorded one. On this segment, we're going to connect live to the commissioner herself, who will be addressing some issues, and she will also take questions from the public. I know that throughout 30 minutes or thereabout, that interview was on. You would have been listening, and it is now time for us to have feedback from you. Ask questions, and then also send us SMS messages when necessary. You ask questions, and then we will also connect you to the commissioner, who will be answering your questions when you throw them at her. And so we'll connect to the Honorable Commissioner for... Hello, Honorable Commissioner, are you on with us?
Good afternoon, Mr. Grace.
Oh, good afternoon.
On with you.
Yeah, a while ago, we Rivers people watched you when we recorded you in your office, and you talked eloquently well about your ministry and the government policies as it relates to health. So that was an eloquent and very brilliant session we had with you.
Thank you very much, Mr. Grace.
We will now open the telephone lines for our viewers to also connect to you by way of connecting to the studio. They will connect to you and then ask you questions on some of the issues that you talked about in that recorded program. And here in the studio too, there are some areas that we didn't cover earlier on when we recorded you in your office. We'll also ask you those questions, and then you find answers to them. Will that be okay by you, Ma?
That's fine. Thank you.
All right, we're on to RSTV, and the program is Stewardship with SNB live from the studios of RSTV here in Port Harcourt. Like I informed you earlier on, the Honorable Commissioner was being recorded in her office. The video that played out earlier on was not live, but I know that he must have picked one or two issues, things that she talked about, and then you have some questions to ask her. It is now time for you to ask her questions. Telephone lines are already displayed on the TV set. You can avail yourself the opportunity to call in, and I will do well to pick your calls. Where you can't call, you can also send SMS. We'll read out your SMS. But let me set the rules. The rules is that you will not throw tantrums. You will be decent about the way you talk, and then the way you ask questions. We will not condone a situation where you throw invectives on our guest, even though she's on phone. And so that's the rule. If you do so, we'll just disconnect you and then connect to another person who will be making sense to us. And so the telephone lines, once again, are displayed on your TV set. But before you call us in, let me ask Honorable Commissioner this question that we didn't cover. Honorable Commissioner, are you still there?
Yes, I'm here.
All right. Are you aware that patients at the primary healthcare level are compelled to buy syringes? Is it approved by the ministry? When mothers go for antenatal and postnatal care, they are compelled to buy syringes. We are thinking that syringes are free. Government has provided syringes free for all patients. Is it approved by your ministry?
Thank you very much for asking that question. And this brings me to the issue of racketeering that has been reported to the ministry and to the state government over time. And so where in facilities where essential commodities have been provided and communicated that they are for free, individuals who are seeking medical care are not supposed to pay for such items. And so this is another reason why the ministry is trying to open channels of communication so that where such reports can be made, there isn't a hindrance to us receiving such information and taking action where necessary. And so I'd like to use this opportunity to highlight to the Rivers people of the Ministry of Health to receive information that we can verify and take action, because one thing that this administration of His Excellency Governor Siminalayi Fubara is keen on is the fact that our people should not be exploited in the process of seeking quality healthcare services.
Honorable Commissioner, it may interest you to note that most of these primary healthcare centers, when mothers go for health care and all of that, the caregivers there collect what is called tips, which ranges from 1,000 to 1,500 naira and sometimes 2,000 naira before they can attend to you. And if you're unable to pay, they seize your card. So one is wondering what the ministry is doing to checkmate all of these excesses on the part of primary health care givers.
So it's are supposed to pay for in form of co-payment or what it is that's been provided freely, and ensuring that information goes out to the public on what the rights to services are, so that at every point in time, the people know their expectations of government. I think that a lot of the information asymmetries where individuals, the public, are not aware of what government has proposed, leaves room for some of this expectation, and that is a clear step that we are taking to make sure that the health of our people is protected and their rights are protected as well.
All right, that was Honorable Commissioner for Health in Rivers State, Dr. Adeze Ore. We'll take more calls now. I think telephone lines are buzzing. Let's hear from the first caller. Hello, good afternoon. Hello?
Hello, good afternoon.
Good afternoon. You may say your name and where you're calling us from, please.
All right, my name is Obua Chukwunoye. I'm calling sincerely from Ikure local government area of Rivers State.
Say that again. Your name is what?
Obua Chukwunoye.
Okay, Obua Chukwunoye, calling from Ikure local government area.
Yes.
Honorable Commissioner, can you hear him?
Yes, I can hear you.
All right, go on, Chukwunoye, go on.
Okay. One of these days, I went to the primary health center to pick up a death certificate.
Birth certificate?
And, yes, death
Okay.
certificate for my daughter.
Okay.
Actually, the child was delivered at that health center. All the antenatal activities were carried out in that health center.
Okay.
Just because I was unable to pick up that death certificate at the date of the delivery, I went back there after 6 years. So even I went back with a card
Okay.
I used at the health center during the antenatal period.
The registration card.
Yes. And
Okay.
they proved that the child was actually delivered at that health center.
All right.
But I was asked to pay the sum of 3,000 naira before I can be given the death certificate.
Okay. All right. I think the health commissioner is listening to us. Honorable Commissioner, did you hear him?
Yes, I heard him.
Could you respond to him, ma?
Yes. Could I get his name again, please, so I can address him properly?
Chukwunoye is his name. Chukwunoye.
Okay. Mr. Chukwunoye, thank you for sharing this experience. Definitely, it is something that will be looked into because, of course, the birth certificate should have been issued by that facility.
Free of charge.
Now, yes. So if it had previously been issued and something had happened to that certificate, then perhaps there was a cost towards reissue. But on air now, I will tell you for sure that I'm going to look into this because
Okay.
you have clearly given us the identity of the facility where this took place.
Somewhere in the Ikwerre local government area.
Yes.
Okay.
If we can get the exact location of the PHC where this happened,
Okay.
and then we'll take it off.
All right. Let's hear from another caller. Hello. Good afternoon.
Good afternoon, sir.
Good afternoon. Your name and where calling us from, please.
I'm sorry, I'm calling from Rumokrusi.
You're calling from Rumokrusi.
Rumokrusi.
You didn't tell us your name.
Huh?
Your name is Charity.
Yes,
All right. Could you be a little bit audible, Charity?
sir.
Could you raise your voice level, please?
No, I want to ask a question. My question is this. Some weeks back, community health workers, let me say primary health care workers, we are promoted. Those on senior level, then they say that the senior workers will be promoted in the council. It's up to now, nothing has been done about it.
You didn't tell us your name. You didn't tell us your name.
I think my name is Terry.
Oh, Charity. Okay, from Rumokrusi. Okay, you're asking why junior health workers have not been promoted.
The junior health workers are not said the local government will take care of that. Meanwhile, the senior health workers have been promoted in the primary health care board.
All right, Charity, I'll leave you in the safe hands of the Honorable Commissioner for Health. Honorable Commissioner, you may respond to that question.
Yes, Mrs. Charity.
Yeah.
Good afternoon. Yeah, will I say the remuneration of different levels or different cadres of healthcare workers is across different levels. So we have those who are within the employ of the local government area. We have those who are employed by the various boards, either the primary healthcare management board or the hospital management board or the Ministry of Health. So if your remuneration at the moment is coming from the level of the local government area, then that is where the promotion exercise will take place. However, promotions are still ongoing. They have not been concluded in any of the spheres of employment in the health sector in the state. And so at the end of the exercise, all the recommended promotions will be reviewed and individuals will begin to be notified. So I will ask you to just exercise some patience while the process is ongoing and streamlined to ensure that all individuals who are employed in the state eligible for promotion will be considered in due course.
All right, I think that answers Charity's questions. We are still on to Stewards with SNB, live from the studios of RTV here in Port. We have another caller here. Good afternoon.
Hello, good afternoon.
Good afternoon. Thanks for joining us on the program.
Thank you, sir.
All right, we have the Commissioner for Health, Dr. Daisy, on phone.
Okay. I have a question to ask.
Go on.
No.
Where are you calling us from? Hold on. Where are you calling us from, and what's your name, please?
Okay, sir. I'm calling you from Elele. My name is Apostle Mo.
Apostle Imo. All right. All right. Thanks for joining us.
Okay.
Go on with your questions or your suggestions. Hello, Apostle. Hello. Oh, we lost him there. All right. Honorable Commissioner, are you still on with us?
Yes, I am.
All right. While we're waiting for our viewers, okay, we have another caller here. Good afternoon.
Afternoon. Good afternoon, sir.
Good afternoon. Your name and where you're calling us from, please.
Okay, I'm calling from Rumekini.
Rumekini. Your name?
Yes, sir. I'm Joseph Tom.
All right, Joseph Tom. Thanks for joining us on the program.
Okay, please, I want to ask because I went to the healthcare center for my daughter to be immunized. So I discovered that the money they were collecting there is nothing to it. The money was more. So I want to ask if it is from the job that they've been.
You went for immunization,
Yes, sir.
and then they're asking you to pay money.
Yes, sir.
Did you pay?
Yes, sir.
How much did you pay?
I pay almost 3,000 naira.
To immunize your child of what?
It was a little baby, 6 months old.
And you paid almost 3,000 naira. All right, let me hand you over to the Honorable Commissioner to find answers to those questions. Honorable Commissioner, please, over to you.
Thank you, Mr. Joseph. Congratulations on your baby. Kindly confirm to me what you were told that payment was for.
Hello, Joseph. Hello, Joseph. Are you still there? Or we lost him. But let me just add up. He said it was for immunization. Yes. He took his little baby to the
Yes.
health center.
I got that.
Yeah.
What I wanted to verify was if he was told he was paying for the vaccine, he was paying for the syringe. That's what I wanted to elicit from that question.
Probably. He
Yes.
paid about 3,000 naira.
Good.
Yeah.
Thank you. That's sufficient information for me to work on.
All right. Let's hear from another caller. Good afternoon.
Good afternoon, sir.
Good afternoon.
Good afternoon, sir.
Okay. Your name and where you're calling us from, please.
My name is Leto. Okay, I'm calling you from Kana local government.
Leton OK, calling from Kana local government area.
Yes, sir.
This is Stewardship with SNB live from the studios. And the Honorable Commissioner, Dr. Daisy Ore, is on phone to take your questions. Could you turn down the volume of your TV set as a hallback, please?
Yes, I do.
Okay, turn it down, the volume.
Since we are on health issue, I want to ask if you went to Bori to see the beautiful house that our former governor built, the hospital, and the place now is not a grow grass and cover everything, and nothing is done, nothing is happening there. So I want to ask, why is it like that?
All right. Honorable Commissioner, you heard him?
Yes.
All right, you may respond.
Good afternoon, Mr. Letton.
Afternoon.
Mr. Braid, could you get him to reduce the volume of his
Okay,
TV?
Mr. Lector, again, please, could you turn down the volume of a TV set? Move away from your TV. I know you want to hear yourself.
I do.
Please. All right. All right, Honorable Commissioner.
Yes. One of the first assessment visits that I conducted following my appointment was the visit to the Bori Zonal Hospital, which Mr. Letton just referred to, and which was initiated under the previous administration and awarded for completion and equipping. So the project actually commenced prior to the COVID-19 pandemic. And so about that time, there were issues with the handover of that project.
Okay.
And so, based on my assessment on the ground during that visit, I saw that a lot of the facilities that had been put in place had run down, because you know that it's been about 3 years of having a place that had not been handed over. And so one of the directives of His Excellency Governor Fubara was a total assessment of such projects to know where they are for concrete action to take place on how to get them completed, operational and functional, so that people can benefit from the services that can be provided there. So that is something that we're actually carrying out at the moment, Mr. Letton.
Mr. Letton, is that okay by you? All right, he has dropped his line. Let's hear from another caller. Hello, good afternoon.
Good afternoon.
Good afternoon. Your name and where you're calling us from, please.
My name is Peter.
All right, Peter, calling us from where?
I'm calling from Omoma local government.
All right, Peter from Omoma. Your questions or your suggestions, please.
I want to ask, why the only government hospital in Omoma is covered by grant and no one is functioning?
All right, the only government hospital is covered by grasses, you said?
Grant. The only government hospital in Omoma is covered by grant. Nothing is happening there.
All right. All right, the commissioner heard you. She will respond to that. All right, thank you. But, Commissioner, before you respond to that last caller, let me, as a matter of follow-up, ask this question. Mr. Leto also talked a little bit about it. The past administration here in River State invested so much in healthcare services. For example, the Dr. Odile Cardiovascular Hospital and that of the Mother and Child Hospital. These hospitals, you know, large money was sunk into it, and then Rivers people expect that by now the thing would have been open for services and all of that. But they are still under lock and key. Why is it so?
Mr. Braid, about a week ago, I shared some information via the ministry's public social media handles. And that was a meeting that took place between the leadership of the Ministry of Health and the management of the hospital partners engaged by the state to manage both hospitals that you referred to. And so the question you have put to me was a question that was tabled for discussion that day.
Okay.
And so one of the outcomes, the key outcomes of that meeting was clarity and a streamlined direction for how we can get those facilities up and running as soon as possible so that people can benefit. You recognize that both hospitals are at two different ends of the spectrum. You have one that is an advanced specialist hospital to provide cancer care, cardiovascular, heart disease management.
Yeah.
And then you have another that is catered towards maternal and child health, and then reproductive health services. So while these are two different areas, we emphasize the burden of need of Rivers people to access care in those two facilities. And so we've actually kickstarted a method where we'll be receiving real-time information on the progress towards getting those two facilities up and running. So that's the status on both hospitals for now.
All right, Honorable Commissioner, we'll let you go, but just before we do that, this last question, if we don't ask this question, we'll be doing a disservice to Rivers people. You will agree with me, Honorable Commissioner, that in the past administrations in Rivers State, the government had what is called emergency health services for accident victims. What happened to the hotlines and, of course, the rest of them?
Emergency health services are a key part of a functioning health system. And over the course of various past administrations, they have been at different levels. And this is something that is important to our executive governor, His Excellency Governor Fubara, that people from and residing in Rivers State have access to quality care, be it emergency care or elective care in the hospitals and our health centers. And so part of that will be reviving emergency services. And so that's something that we should be looking forward to, that we in the Ministry of Health are working towards. Of course, we also know that the Emergency Services Department of the Ministry of Health is actively engaged in the River State Government Flood Management Committee. We know that there are certain communities in our state that are currently undergoing the negative effects of floods and associated hazards. And so the Emergency Services Department is part of that process of mitigating the effects for our people.
All right, Honorable Commissioner, thank you so much for finding time to join us via the telephone. We appreciate you.
Thank you very much for the opportunity.
All right, that was Dr. Adeze Ore, the Honorable Commissioner for Health here in River State. She spoke to us earlier on in a recorded video, and then she was live on phone with us. I know that you are better informed than the way it was before you joined this program. We'll join you again same time next week with another guest. My name is Solomon Nelson Braid. Bye-bye.
On every Thursday of the week, this seat beckons at those who superintend over institutions of government, be it politics, economy, personality, or even social-religious life, to give account of stewardship of what leaders have done or doing with the resources allocated to them at all levels and spheres of life. Watch Stewardship on RSTV every Thursday at 12:30 p.m. Stewardship with SNB, a point-blank approach to TV journalism.